Today we will discuss acoustic neuroma, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Acoustic neuroma is a type of non-cancerous tumor that grows on the vestibulocochlear nerve, which is responsible for hearing and balance. This nerve connects the inner ear to the brain. As the tumor grows, it can press on the nerve, leading to symptoms. Common symptoms include hearing loss, often gradual and affects one ear. Tinnitus, ringing or buzzing in the ear. Balance problems, feeling unsteady or dizzy. Facial numbness or weakness. In some cases, it can affect facial nerves. How to know if you have one? If you experience any of those symptoms, it's important to consult a healthcare professional. They may recommend tests such as hearing tests to check for hearing loss, image tests like MRI or CT scans to visualize the tumor. Early diagnosis is key, so if you have concerns, seek medical advice. If someone has an acoustic neuroma, here's what they can do. They can see a doctor, make an appointment with a healthcare professional for evaluation, get tested, follow up with hearing tests and possibly an MRI or CT scan, discuss options, talk about treatment options with the doctor. These may include monitoring, if the tumor is small and not causing major problems, surgery to remove the tumor if it's causing significant issues, radiation therapy to shrink the tumor. Manage symptoms. Follow any advice for managing symptoms like hearing aids or hearing loss or balance exercises. Stay informed. Learn about the condition and ask questions to understand it better. Always keep in touch with the healthcare team for ongoing support and follow-up. In the hospital, treating someone with an acoustic neuroma typically involves the following. Assessment. Doctors will check the patient's symptoms and review test results. Imaging. They may perform an MRI or CT scan to see the tumor clearly. Treatment plan. Observation. If the tumor is small and not causing major issues, they might just monitor it over time. Surgery. If needed, a surgeon will remove the tumor and this can relieve symptoms. Radiation therapy. This might be used to shrink the tumor instead of surgery. Post-operation care. After surgery, the patient will be monitored for recovery, which may include managing pain and monitoring hearing and balance. Follow-up. Regular checkups will be scheduled to ensure everything is healing well. The goal is to relieve symptoms and improve quality of life. Medications are not typically used to treat acoustic neuroma directly, but doctors may prescribe certain types to manage symptoms. Here are some examples. Pain relievers such as ibuprofen, brand name Advil or Motrin, acetaminophen, brand name Tylenol, steroids, dexamethasone to reduce inflammation and swelling after surgery, antiemetics, meclizine, brand name Antivert to help with dizziness or vertigo, antidepressants or anti-anxiety medications, sometimes prescribed if a patient experiences anxiety or depression related to their condition. Hearing aids. While not a medication, these can be used to help manage hearing loss associated with the tumor. Always consult a healthcare professional for specific recommendations and discuss potential side effects. People who may be at an increased risk of developing acoustic neuroma include age. It's more common in adults, especially between 30 and 60 years old. Genetics. Those with family history of the conditions or certain genetic disorders like neurofibromatosis type 2 and F2 have a higher risk. Radiation exposure. People who have had radiation therapy to the head or neck are at a greater risk. Gender. It tends to occur slightly more often in women than men. While these factors may increase the risk, it doesn't mean everyone with them will develop acoustic neuroma. Now you need to watch my video on rhabdomyolysis or have a look at pneumonia.